Hi everyone, my name is Jeanette Chambers and I'm a registered dental hygienist, and I also have an interest in the public health and the relationship between oral health and general health. I have with me tonight two other people who have an interest in oral health, and one is Sigal Reese, who is the director of the health department here in our town, and she reports to the elected boards of health and is charged with protecting health of the community. And this is done through regulation, enforcement, and community disease surveillance and prevention. Sigal has been a director for 9 years here in town and has worked in local public health for 13 years. Linda Davenport is the outpatient dietitian at Stewart Norwood Hospital and has been for 30 years. She is also the diabetes educator there. She runs diabetes and weight management classes and support groups for diabetes and bariatric surgery patients. She also works in private practice and is a member of the Norwood School Health Council. In honor of National Public Health Week, this show is focusing on oral health, how it relates to general health, and how each of us can have oral health and a healthy body through what we eat. We'll first hear from our town's head of public health, Sigal. And our town has two important oral health projects that run on a regular basis that are aimed at oral health. So maybe you could tell us about those. Sigal.
Sure, thank you.
All right.
So oral health is a key part of overall health. The health department has two programs that address oral health. The first is a partnership with the schools and Dr. Mark Stone, a pediatric dentist in Norwood. Dr. Stone screens students in grades 1 through 6 at the schools, and the results are sent back to parents with an invitation to visit the dental clinic in Town Hall. The department has a dental hygienist and a dental assistant on staff to provide cleaning and sealants to the students, again in grades 1 through 6. In addition to the cleanings and sealants, the hygienist reviews proper brushing techniques with the students. All three of these activities are to prevent dental decay. Dental disease is the most common childhood illness, more common than asthma. It can lead to poor eating, sleeping, and affect school performance. We are fortunate to have this unique program in Norwood. Each year, the program sees approximately 1,000 students in the screening phase, and then about 200 students come to the clinic for cleanings and sealants. The department also works with the Elder Dental Program. This program connects seniors with dentists willing to perform dental care at reduced rates. In addition, the program runs screening clinics once a year in Norwood in conjunction with the department's flu clinic. The Elder Dental Screening Clinic provides screenings with dentists and oral surgeon, as well as nutrition and health insurance information.
Thank you, Sigal. I just have one question about the children's program in the school. How do they get from school to the clinic? Do the parents have to take them, or how does that work?
That's a great question. They're actually transported through school transportation.
Oh, that's good. And so it's during the school day?
It's during the school day in the mornings, from 9 to 11.
Oh, that's great. Excellent. So now we'd like Linda to talk to us about nutrition content in foods, and how does nutrition relate to our oral health?
Well, it was interesting because when I told a few people that I was doing this program, they said, well, what does nutrition have to do with dental health? And I said, well, when you think about it, digestion really begins in the mouth. And if people's teeth are, their dentures don't fit, or their gums are infected, or have just poor overall oral health, it's going to influence their food choices. Mm-hmm. And a lot of your really healthy foods require a lot of chewing, breaking the food down. Mm-hmm. So it can definitely have an impact on what their food choices are and their overall health. Mm-hmm. The other, as a diabetes educator, periodontal disease or gum disease is now considered one of the complications related to diabetes. Mm-hmm. So it can actually work both ways. If mm-hmm. someone's diabetes is not well controlled and their blood sugars aren't well controlled, it's going to affect the periodontal disease. And at the same time, if their periodontal disease isn't addressed, it can affect their own, struggle with managing their blood sugars. So, there's definitely a link with that. Mm-hmm. But it's not just sugar that's the problem. Sugar itself isn't really going to, promote all the cavities. Mm-hmm. It's a lot of other carbohydrate foods, mm-hmm. the sticky carbohydrate foods. in how often you eat those foods. So the frequency is important. You know, if you're breaking off a piece of granola bar or just sort of grazing throughout the day, you may have more detrimental effect on, you know, your overall oral health. So, you know, the higher fiber foods, things like fresh fruits and vegetables, is important. And the new dietary guidelines now is actually encouraging certain limits on regular sugar. So I don't know if the 50 grams a day, I don't know if anyone's heard that, or about 10% of your total calories should come, or that should be your limit for sugar. So the Heart Association is recommending no more than 9 teaspoons a day of sugar for men and 6 teaspoons a day for women. Just to give you a reference on that, I brought a muffin to show you, which is a typical size. So this particular muffin here would provide about 51 grams of sugar.
And so how many?
And about 600 calories.
Ooh.
So about 12 teaspoons of sugar in
that
one muffin. And this could easily be a snack for someone. It could also provide a third of your calories for the day.
Right.
And again, nibbling on this throughout the morning is going to be more harmful to you
Right.
also than to eat it all at
Certainly for
once.
your
But
teeth.
you know, ideally, I guess if you decided to have a muffin, it would be more in the size of this.
Yeah. Yeah.
So with the new labeling is going to be coming out soon too, in the next year or two, because manufacturers have a time frame that they
Yes.
can, you know, it's expensive to change labeling on food products, but you will begin to see added sugars. So under, you know, right now it has total carbohydrates and just and sugar. It
Yeah.
doesn't really separate out.
Right.
Yogurt's a good example because this is a plain yogurt that has 9 grams of total carbohydrate, and it tells you it has 9 grams of sugar. And this is a plain yogurt with no added sugar. This is just the carbohydrates coming from the lactose in the yogurt. So I just wanted to show another example. So this is your typical low-fat yogurt with fruit. It has 25 grams of carbohydrate and 15 grams of sugar. So,
And
you
it's
know,
and the
and-
serving size is equal, right? It would
right.
be
When
yeah.
you look at, most of the time, they do try to make the serving sizes comparable, so
Yeah.
it makes it easier for the consumer.
Yeah.
But I thought it was interesting when you looked at the ingredients on the fruited yogurt, the sugar on the list of ingredients came up before the strawberries.
Oh,
The strawberries.
that's
So,
not good.
so a healthier choice would be to start with the plain yogurt and add your own fresh fruit without an added sugar.
Now, how would frozen fruit be all right to add?
Yes,
to that?
there's actually some
Yeah.
very good, especially in the winter when we don't have as many choices on
Yeah.
fresh fruit. You can get a lot of unsweetened frozen fruit, everything from cherries to berries, and
Yeah.
that's a good choice.
Yeah. So another way that people get sugar, of course, is through soda. And this is a very small can of soda, 7 ounces to be exact. And there's 8 sugar cubes is what would be the sugar content in this. And the 8 cubes end up being 20 grams of sugar in just that small 7-ounce can. So you can imagine if you had, you know, a 12-ounce, whatever, the
Right,
regular
and most
size.
vending machines is going to have 20 ounce, so
Oh,
it just keeps
so,
escalating.
yeah.
And a lot of times people don't consider the liquid calories they consume in a day.
Right.
So you can, and what those are calories that we call empty calories. So
Yeah.
there's really no nutritional value
Yep.
from that either.
Yeah. So how about telling us about the kind of diet that would be good for the teeth? What would be,
Really, I mean, for overall health, the Mediterranean diet seems to be the leader.
yeah,
So again, it's a lot of fresh fruits and vegetables, a lot of plant-based proteins.
Yeah.
If you want to, search the Mediterranean diet, there's a lot of good information out there. Whole grains rather than the refined grains. Beans is a part of the diet, and it's a very colorful plate. So I teach people too, a simple thing is to look at your plate, and if it's really just brown and white, you need to think of ways to add color. So bring in the vegetables, bring in the fruits on a regular basis.
Now, when When you hear about the Mediterranean diet, you may be thinking of pasta. How does pasta relate to?
We've got lots of
Yeah.
ancient grains to pick from. I don't think anyone's ever going to give up pasta completely. There's wheat pasta, there's white pasta. The wheat would be a better choice, but it also is important that you look at your portion, because that's where we get into trouble.
Right, right. So the Mediterranean diet would be good for your oral health as well, because with the chewing the vegetables, if they're raw vegetables or fruit, is always good for the
Or
oral
a
health.
typical Mediterranean snack, maybe say some nuts, a handful of nuts and a piece of fresh fruit is always a good choice.
Okay. So it's clear that what you eat helps your teeth, or doesn't help your teeth if it has a lot of sugar in it, or is sticky, or if you eat it over the course of many hours instead of eating and then maybe rinsing your mouth or something. So it is important that what we eat is reflected in the sugar content is lowered so that our teeth are healthier, and then also our body's healthier. So to help prevent cavities, we have important things in our diet and also in our preventive care that we can get through, through public health interventions, but also through private practices. But the third thing that's important is how we take care of our teeth and clean them at home, and that's to keep the bacteria off the teeth. The way cavities start is through eating carbohydrates, sugars, but also you have to have the right bacteria in your mouth and that cause cavities. So the importance of keeping your teeth clean is very important in preventing both cavities and preventing gum disease. So I wanted to just go over a little bit of proper brushing that works for most people. So the way I'm going to show you is probably a good way for most people to brush their teeth. You would want to first, you want to direction your bristles so that part of the bristles touch the gum and the tooth at the same time. And then you just do small, gentle circles, always with a soft toothbrush and not too big a toothbrush. So you just do small circles right along the gum line. And you want to start, in one spot and go all the way around so that you don't miss anywhere. And then you do the same on the inside, and then in the front you can brush up and down like that. And then on the bottom teeth, you do it the opposite. And you direction the bristles towards the gum, where the gum and the tooth meet, and just do small circles all the way around. Now children need to have their teeth clean too, because actually cavities, as you mentioned, it's a most prevalent childhood disease. So you want to start cleaning children's teeth as soon as they come into the mouth. And for babies, you just use a small little face cloth and rub the teeth. And then once they're able to sit in your lap, you can start actually brushing children's teeth. And you can brush, the chewing surfaces of the baby teeth. And then, gently brush along the gum line of their teeth also. And it's important that parents and caregivers brush their children's teeth until they're around 8, because kids just don't have the dexterity to do a good job up until that time. Other things that are necessary to keep the teeth healthy are things that clean in between the teeth. And there's all kinds of products now. Of course, there's your trusty old dental floss. And then there's floss on little picks that you can floss if you can't handle all that string. There's little brushes that you can use in between your teeth. Show you what these look like. Little teeny brushes, and you just break one off. Kind of use it like a toothpick. Brush in between and go in between your teeth with it. Then we have little wooden, like toothpick things, but they're softer wood. They're called Stimudents. Those are good to use also. And then there's bigger brushes. These are bigger. If you have bigger spaces between your teeth, you can use these things. It's very important to keep the teeth clean, eat a good diet of fruits, vegetables, and try to limit your sugar. And then get preventive care through the services that we have here in our town, but also if you can get to a private dentist office and get preventive care, that's a good thing too.
have a question.
Yeah.
Someone asked me recently about if they have dentures.
Yes.
Do they still need to see the dentist?
Yes, you should.
I
Or
thought to just look at the whole oral cavity.
yes, or go to the senior citizen. How frequently do they have those screenings for the senior citizens?
So the program that connects seniors with dentists that will work at Reduced Care is year-long. That's ongoing.
Oh.
But the actual clinic we have is once a year.
Once a year, okay.
Once a year at the senior center.
Okay.
Usually in October.
Oh, very good.
And
yeah.
that's advertised through the Council on Aging newsletter, and we
Yeah.
put it in the papers.
Yeah. So in actuality, that's adequate for someone with dentures to get an exam once a year,
Okay.
to check for any changes in the soft tissue, to check and see if the denture's fitting properly, if they might need an adjustment or a relining of the denture. You know, so yes, you do have to go see a
If they're
dentist,
fit.
or if they
Okay.
make sure they fit.
Okay.
Right.
And then also patients with diabetes, some insurances will cover more than.
More frequent
more
dental
frequent
cleanings,
cleanings,
yes,
which is
important. Yeah, yeah, very important. And it's really possible, I think, to have a healthy mouth through your own interventions. If you work on keeping them clean and watch the things that you're eating and get some preventive care regularly, I think it's very possible to have a healthy dentition and oral environment. And in the long run, it'll help your whole body too, because if your mouth's healthy, it means you're eating healthy food and keeping things clean, and I think that helps your overall health. So
And
I want
instead of soda, drink the fluoridated water.
That's
Right?
it, the fluoridated
And now
water.
the water tastes great. So
Yeah, that's right. We have great water here in town, that's
Yeah.
for sure. Yeah. All right, well, I want to thank both you and Linda and Sigal for being here, and I think, I hope that everyone learned something, and that maybe you can improve some of your eating habits or maybe your home care habits through what you learned today. Thank you. Good night.
Thank you.
Thank you.